Hello everyone, this is Dr. Midhun, and I'm doing super specialty in critical care. This is another discussion in our toxicology part, uh, like very interesting ethylene glycol poisoning. So, ethylene glycol is a main ingredient in many automotive antifreeze products. It has a sweet, agreeable taste, which makes it a popular method of attempted suicide. So, coming to the metabolism of ethylene glycol is converted into glycoaldehyde by alcohol dehydrogenase, and glycoaldehyde is further converted into glycolic acid, by aldehyde dehydrogenase. The glycolic acid is converted into glyoxylic acid, then which is then converted into oxalic acid, which combines with calcium and forms calcium oxalate. So we know fomepizole and ethanol are both competitive inhibitors, and they are the antidotes of ethylene glycol poisoning. Fomepizole, it inhibits alcohol dehydrogenase and inhibit the first step of ethylene glycol metabolism. So and also thiamine and pyridoxine are also supplementary medications that we give in ethylene glycol poisoning. Thiamine converts glyoxylic acid into alpha hydroxy beta keto adipic acid and prevents the formation of oxalic acid. uh, at the same time, pyridoxine converts glyoxylic acid into glycine, which then combines with benzoic acid and forms hippuric acid. So these are all non-toxic metabolites. So thiamine, pyridoxine, and fomepizole, ethanol, everything prevents the conversion of prevents the formation of oxalic acid. Yeah. So which is the most dangerous metabolite in ethylene glycol poisoning. So coming to the major issues because of ethylene glycol poisoning. As I told you, oxalic acid is the most dangerous metabolite, which then combines with calcium to form calcium oxalate. Uh, because of formation of calcium oxalate, there can be hypocalcemia. Calcium oxalate deposition in the renal tubules can cause renal tubular necrosis, and we can see increased osmolar gap in ethylene glycol poisoning because it is an osmotically active product, and high anion gap metabolic acidosis because of the formation of oxalic acid. And as I told you, because of renal tubular acidosis because of calcium oxalate deposition, patient can end up in AKI. This is the same thing that I told you, metabolism of ethylene glycol. So early signs can include nausea, vomiting, altered mental status, slurred speech, and ataxia. Ethylene glycol is odorless. There is no odor of alcohol on the breath. Severe cases can come up with depressed consciousness, coma, generalized seizures, renal failure, pulmonary edema, and cardiovascular collapse. Renal failure can be a late finding, 24 hours after ingestion. Serum lactate levels can be elevated. It can be like 5 to 6 milliequivalent per liter. A plasma assay for ethylene glycol is available, and a level more than 20 milligram per dl is considered toxic. So coming to the management part, fomepizole inhibits alcohol dehydrogenase, as I told you, the enzyme involved in the initial step of ethylene glycol metabolism. The best results are obtained if the therapy is begun within 4 hours of ingestion. Clearance of ethylene glycol and all its metabolites is enhanced by hemodialysis. The indications for an immediate hemodialysis include severe acidemia, pH is less than 7.1, and evidence of significant organ injury is there, like coma, seizures, renal insufficiency are there. And as I told you, supplementary medications, thiamine 100 milligram IV daily and pyridoxine 100 milligram IV daily are recommended to divert glyoxylic acid to the formation of non-toxic metabolites. So this is the dosing regimen for fomepizole. We start with an IV loading dose of 15 milligram per kg, follow with a dose of 10 milligram per kg IV every 12 hours for 4 doses, then increase the dose to 15 milligram per kg IV every 12 hours and continue until the following endpoints are reached. Plasma toxin level less than 20 milligram per dl, the plasma pH is normal, and the patient is asymptomatic. If more than one hemodialysis session is required, change the dose to 15 milligram per kg IV every 4 hours until dialysis is no longer necessary. So this is about the management of ethylene glycol poisoning. And then we can come to a very specific, not specific, a very interesting finding that we can see in ethylene glycol poisoning. Calcium oxalate crystals in urine are seen in about 50% of the case of ethylene glycol poisoning. The presence of calcium oxalate crystals is not specific for ethylene glycol poisoning, but the shape of the crystals is more specific. So we can see thin monohydrate crystals in ethylene glycol poisoning. So this is about the symptoms, signs, metabolism, and management of ethylene glycol poisoning. So this is done for today. So in the next video we'll come up with a new session on toxicology. Please subscribe to my channel. Thank you so much.